Hello, today we'll be talking about imaging diagnosis, technologies, Malaysian insights, historical evolution, and clinical necessity. So, exploring advancements and clinical roles in medical imaging. So, a few agendas today. We'll be overviewing on the imaging diagnosis technologies. We'll look at the historical development of imaging diagnosis and how it affects in Malaysia, the key facts and the insights, and clinical importance of imaging diagnosis. We'll go through the overview of imaging diagnosis technology. So, regarding the principles and uses of X-ray imaging, X-ray imaging employs ionizing radiation to create detailed images of internal body structures, focusing mainly on bones. So with these ionizing radiation, they can actually be reflected by condensed structures like bones. So that's why they are imprinted in X-ray films. X-rays are widely used to diagnose fractures, infections, and other abnormalities quickly and effectively. So not just bones, but they can also be used to X-ray the lungs, inside the lung. And the speed and accessibility of X-ray imaging make it a primary tool in medical diagnostics worldwide. So among the first imaging tools that doctor would usually recommend would be X-ray. Fundamentals of MRI, or magnetic resonance imaging. MRI uses powerful magnetic fields combined with radio waves to produce detailed images of body's internal structure. So unlike X-rays that take frontal or side view, so this one actually produces a detailed image of the inside from the top view down. MRI excels at creating detailed images of soft tissues, organs, and nervous systems for accurate diagnosis. So the advantage of MRI is not just bones, but they can also help to create imaging of the organs and soft tissues as well. MRI is crucial for detecting tumors, neurological disorders, and musculoskeletal conditions with high precision. Introduction and application of computed tomography, or we call CT scan. CT scan uses multiple X-ray images from various angles to create a detailed cross-sectional body view. So CT scan is something between X-ray and MRI. CT scans provide rapid and detailed imaging essential for diagnosing acute medical emergencies. CT imaging helps detect cancers early and guides precise biopsy procedures for effective treatment. Let's look at the historical development of imaging diagnosis. So X-rays were first discovered in 1895, which marks a milestone in medical imaging and diagnosis history. X-rays enable non-invasive visualization of internal structures, meaning that without opening up the body, without opening up skin, you're able to view the structures, mainly bones, transforming medical diagnostics forever. Rapid early adoption of X-rays expanded diagnostic capabilities worldwide, which improves healthcare. MRI and CT technologies were developed in the late 20th century, which was mainly to improve medical imaging capabilities, which were the X-rays, which were the weakness of X-rays, limitations of X-rays. So MRI and CT technologies were developed. These modalities provide superior image resolution and better tissue contrast than traditional X-rays. MRI and CT expanded diagnostic options by revealing intricate anatomical details and abnormalities. So major milestones in global imaging diagnosis. The introduction of digital imaging revolutionized medical diagnostics by enhancing image clarity and storage capabilities. So the development of PET scans or PET scans allowed detailed functional imaging, improving disease detection and treatment planning. An integration of imaging with computer technologies enhanced medical accuracy and streamlined patient care management. So let's see about the diagnosis or image diagnosis in Malaysia. First, we will look into availability and accessibility of imaging technology in Malaysia. So Malaysia has increased investments in imaging technology within both public and private healthcare sectors to enhance diagnostic capabilities. Access to imaging technology has improved notably in urban centers and certain rural areas, enabling better healthcare services. So despite improvement, remote regions still face challenges in accessing modern imaging technology, which limits the healthcare quality and equity. Imaging diagnosis enables early detection of disease, allowing timely intervention and better patient prognosis. And diagnostic images guide healthcare professionals in planning effective treatment strategies tailored to patient. So in Malaysia, diagnostic imaging is a crucial part of treatment strategy and planning. Imaging techniques are crucial for monitoring treatment effectiveness and patient recovery over time. So some notable institutions and advancements in Malaysia. So when we talk about advancements in imaging, when it comes to advancement in imaging equipment, Malaysia is no stranger, being home to some of the most advanced imaging technologies in the region across medical specialties including cardiology, gynecology, oncology, and also orthopedics. This puts the country in a unique position to become a leading global healthcare destination for patients in the country and beyond, enabling us to offer quality care at an affordable pricing. University Malaya Medical Center and Institute Cancer Negara are key institutes driving healthcare advancements in Malaysia, and these institutions advance imaging research, enhancing diagnostic precision and treatment effectiveness in healthcare. Their contributions improve healthcare standards and outcome across the region, promoting clinical excellence. So let's go into the clinical importance of imaging diagnosis. So mainly is for early detection and accurate diagnosis of disease. So imaging techniques help identify diseases at their initial stage, which helps to improve treatment success rates. Imaging accurately characterizes disease pathology, aiding precise diagnosis and personalized treatment planning. Early and accurate imaging supports timely intervention, which enhances patient prognosis and outcome. So guiding treatment and monitoring patient progress. So medical imaging is also used to help to guide precise surgical procedures, which helps to enhance safety and outcomes. And imaging helps target radiation therapy accurately to affect areas, minimizing damage to healthy tissue. And when it comes to monitoring, imaging monitors patients' response to treatment, allowing personalized care adjustments for better effectiveness. Improving patient outcomes and reducing invasive procedures. So non-invasive imaging minimizes the need for exploratory surgeries. So surgeries that involve opening up to diagnose what's wrong with the patient is reduced, and reducing patient trauma and surgical risks. So with surgery, there are risks involved such as infection. So this helps to reduce those risks. Using imaging techniques lowers the overall risk of patients by avoiding invasive procedures whenever possible. Patient experiences faster recovery due to fewer invasive interventions and reduced physical trauma. And improved safety and comfort from non-invasive methods lead to higher patient satisfaction and quality of care. So in conclusion, imaging diagnosis technologies have advanced significantly, becoming essential tools in modern healthcare. And in Malaysia, development in imaging technology has improved national health outcomes and patient care. And worldwide advancement continues to expand the possibilities of diagnosis and therapy in medicine. Thank you.